Well, Zimbabwe has rolled out its COVID-19 vaccine program, with health workers first in line to get a jab of the Sinopharm vaccines donated by China. Officials applauded after Zimbabwe's Vice President Constantino Chiwenga, who's also the health minister, received his vaccine yesterday. Zimbabwe's free and voluntary vaccination program aims to reach 10 million citizens and achieve herd immunity. The Southern African country has so far reported more than 35,000 COVID-19 cases and more than 1,400 deaths. A little earlier today, I spoke to Dr Agnes Mahomva, who's the chief coordinator of the national response to the COVID-19 pandemic in the President's office and cabinet. And she outlined the broader plan for Zimbabwe's vaccination program. So your vaccine rollout program has begun this week, and for some it perhaps came sooner than believed. You must be delighted.
We are extremely delighted, and I agree with you. Some actually were surprised. They actually thought the government was bluffing, but our teams on the ground were working flat out to make sure that indeed our rollout plan was implemented, and it was witnessed yesterday when we launched the program. So we're very delighted, and we're not looking back.
Have there been any challenges so far, or is it all going to plan? I guess it's still early days.
It's still very early days, really. But I think when we started planning, we knew we might have some challenges here and there. And so quite clearly, we're staying focused. We're keeping our eye on those areas that might actually create problems for us. I think the big one, first of all, is really that skepticism that vaccine people think they shouldn't have it and all that. So we're really keeping an eye on that to make sure that we are able to address that. And quite clearly, our launch yesterday with the Vice President Chiwenga himself taking the first jab, we hope it's going to go a long way in addressing that particular challenge.
Yesterday, I spoke to the president of the Nurses Association of Zimbabwe, and he gave me an indication that there are some healthcare workers on the front line who are waiting to see. They're still not convinced about whether they're going to take the vaccine or not. This must be a concern for you, because of all the people that need protection, it's these people on the front line.
It's work in progress, as I said. Before yesterday, I think we had so many who didn't believe, and even at the Wilkins Infectious Disease Hospital, where we launched the rollout, a number of nurses were really eagerly waiting to see who is going to have the first jab. Is this real or not? And so when that first vaccination took place with the Vice President volunteering, everybody really relaxed. And we sincerely hope, as they're beginning to see that, and of course, as we roll out in the provinces and so on, the leadership there is also really playing an active role in making sure that people realize, our healthcare workers realize that we are serious. We are specifically targeting them to protect them. Our rollout, the first phase, is really targeting the healthcare workers for their protection. So we're really prioritizing our healthcare workers. We value them so much, and hence we'll continue working on it.
So the vaccine that first arrived is the Sinopharm vaccine. There's been some questions raised about its efficacy, particularly when one considers the variant that was first seen in South Africa, and I believe has now become one of the dominant strains in Zimbabwe. Is Sinopharm, the vaccine, going to work with the variant that has now appeared?
Well, no one can ever really know all the science, because this is all new. The virus itself is new, the vaccines are new, so we can only continue using the science that we have at hand, and also continue finding more science. As we're implementing, we're gathering our data, we're also doing a lot that we can with our scientists, really standing up strongly to try and make sure that we gather as much information that will guide us to see whether we'll continue with it or whether we need to do anything else differently. But at this point in time, I want to continue saying we're very proud, we're very happy we have started, we'll run with it, but we are monitoring very carefully.
Have any tests been done at all, studies in terms of efficacy in the Zimbabwean setting? Because what we're starting to understand is that this COVID-19 has really affected different population groups, different regions in different ways. So is this something you've already done or you're going to do as you roll out the vaccine?
We're definitely going to do as we roll out the vaccine. That's part of that emergency authorization use of the vaccine, where we do need to ensure that we are collecting certain data. We're making sure we are really paying attention to all the details that you've just asked about. But once again, as I say, this is new. So our scientists are very much up at the front as well, helping us, putting in the protocols that are required. Just yesterday, I had a meeting with our experts committee, and we specifically looked at this to say, what is it that needs to be in place now, not yesterday, so that we're able to be guided by science. Our cabinet has clearly indicated that they want this rollout, this program, to be guided by science. And so our scientists have taken it seriously. They're very much on board, and we're very confident that we will get the data that we want to continue revisiting, strengthening our rollout, and of course, all other aspects of our response.
This is phase one, and as you said, targeting healthcare workers. Give us a sense of what happens next. When can the general population start to think that they can line up to get their jabs? I suppose the next phase might be people with comorbidities and the more vulnerable citizens.
You're absolutely right. Our program is in 3 phases. The first one is, of course, the frontline workers, and specifically in that phase, there are 2 stages. The first stage covering the healthcare workers we talked about earlier, and then, of course, the other frontline workers in that phase, stage 1 and stage 2. Now that we're rolling out, we will now perhaps run into some challenges here and there. We address them, and our timelines might be adjusted here and there. But we are just saying we have started. We are not going back. We're moving forward, and we're guided by science, and we are following those phases that we talked about. Many people were actually asking at the launch yesterday, so when are we getting our jabs? That was a fantastic question. It means people are now ready. They are also now thinking, oh, when can I get mine? That is brilliant, and we like those kind of questions.
And will other vaccines form part of the mix going forward? Are there other vaccines that you've already started to look at?
Absolutely. We are trying to be very strategic, as I said last time, that we are really wanting to be guided by science. We're looking at all the portfolios, the vaccines that are on the table, especially looking at the ones that WHO is also evaluating. You are aware, we also took our time to really revisit and say, which initiatives should we join? When can we do that? What are the advantages and so on? And we've since joined the AU, the WHO, Gavi, COVAX. And so we're quite clearly looking at some of those vaccines that are there, including, of course, the Sputnik from Russia, so on. We are keeping everything on the table, exploring, because we cannot afford to just be narrow-minded. But at the end of the day, it's about the science that is going to guide us.